And we are live. Well, hello again, Dr. Obioha. It is a pleasure to have you in the studio with us today.
Yeah,
Um,
good evening.
Good evening. So we are back with another edition of The Doctors Are in the House.
Oh,
And,
yeah.
and today we're going to be talking about Black men's health.
Yeah.
And with the title Black Men's Health Matters, Preventing Silent Killers. And
Yes.
so thank you so much for being with us. And we'll dive right into the discussion after um, our first commercial break. So if you don't mind, we're going to play a short commercial and we'll be right back.
From surgical treatment, bed sore, diabetes, or poor circulation, and you've been told to have your foot or leg amputated due to a bone infection, don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
Okay. Welcome back.
We're back. We're back. And so, Dr. Obioha, again, we are discussing Black Men's Health Matters today, preventing
Yeah.
silent killers. So,
Yeah.
why don't you tell us, or at least help us understand why high blood pressure, diabetes, and prostate issues are often called silent killers, particularly in Black men?
Yes. The concept of silent is just kind of like it's put out there just because these are conditions that don't tend to give out a lot of symptoms. In other words, you don't quite recognize that there's something wrong with you until you are either in the hospital in a critical situation or you are actually dead. Something like the blood pressure is actually the big hitter when it comes to silent hitters. One is the a lot of studies have tried to figure out why there's increased prevalence of blood pressure among certain racial groups. It's difficult because of so many of what you will look at as confounding variables in terms of the risk. Take for instance, if Black people tend to live a more stress-related life, maybe due to the general population of low income, if they smoke more, if they act dangerously more, if they avoid consultations with physicians more, then there's a chance that illness like blood pressure, which can easily creep up on you, especially as you get older, is likely to be a challenge in that population. Just the way it is. So overall, if it's difficult to get rid of those confounders that you find prevalent in those populations to be able to say, hey, that these people are actually having more of this problem compared to the other races there. But I think the Asian population has a fairly better, record with when it comes to something like blood pressure. Also, may also be related to the absence of some of these confounders that we talked about in their cultural existence and the way they kind of live and modify their lifestyle. You know, so it's not something that you look at literature and actually pick out right away that this is the reason why this is. So we have a situation, yeah, we have a history that may have put us in this, in this little column as being less privileged. But this is the most privileged generation of this earth we actually inhabit. We have literally everything available to us. We just need to change our lifestyle to use what is available to us to get better. I had made similar comments when I talked about wound healing. I said, when I was younger and going into med school, the things that are available today to make sure that you get a wound healed were not available. So the expectation is that take advantage of what is available to you and get better. Take advantage of what is available to you to make sure that your blood pressure. I mean, you literally can walk into any store and get a blood pressure monitoring device at home. How many people do have it and use it? That's kind of the question. Now, how many among the Black community actually have a blood pressure equipment at home and decide to use it and just document what their blood pressure is when they wake up in the morning, what it is when they go to bed at night? You'll be surprised. Certain other groups tend to have that as a habit. Like that, they can
So,
tell what their blood pressure is and they can talk to a physician who can be able to help them. So
so
one of the things I
what would
want
they
to
be
bring out
looking
in this
for?
conversation is to see how I can enlighten the population so that they kind of recognize little tidbits about what they can do to make their lives better and then make their life even much better when they are communicating to a provider like myself. If you
So,
walk into my clinic, okay, sorry, you wanted to
what
say
are
something.
some of what are some of the tools that you think besides, so you've mentioned a blood pressure monitor,
Monitor,
are
yeah.
there other things that you think that people aren't taking advantage of that they should be using or doing at home in order to promote better health?
Yeah, so like I talked about modifying your lifestyle, something like exercise, exercise must not be done in a gym, must not be some big program that makes it difficult for you to even be compliant with it. Exercise, you wake up in the morning as you are just trying to get your teeth brushed and get a shower, you just get down there and do a few push-ups. I mean, the static exercises actually, as we go on in this conversation, have been shown to reduce the blood pressures better than even the more aerobic type exercises that they are being recommended. The recommendation is to try and moderate, get up to 150 minutes in a week. That's somewhere about 2 hours and maybe 30 minutes in a whole week of exercises that, of moderate severity to improve that aspect of your lifestyle. Now, if you look at it, assuming I'm just trying to look at the low income environment and look at you being able to get in maybe somewhere about 30 minutes every day to get to that 2.5 hours is what is being described as being helpful. So the how can you get in 30 minutes of the day if you're rushing out in the morning, you have to drop some kids off, or maybe you have to catch a bus or train or something, and then to get to work and work God knows how many shifts and then have time to get back. And so why not make it some kind of routine? That way you don't forget it. Make it like something you do before you brush your teeth, something you do before you get a shower. You just get a few push-ups and sweat a lot of them. See how much you can do. You don't have to be the champion in push-ups by just starting it today. You can start with. I don't believe there's an individual that can push up like five. Like just do a little five push-ups and then get up. You have a staircase in your house. Run up and down it for a few minutes and see something that is not gonna need some elaborate bill and some elaborate visit to some place that you may not be able to accommodate within your system for the day. Those are little things you do. Get a nice warm shower, soak in the bath for a few minutes. You know, Try and see how much better you can eat. Don't add salt to your food. Those are the fact that if there's anything I want out of this conversation is the things you can do. You know, Meditate. I mean, if you say a prayer, spend some time and meditate. I don't think yoga may just be too much a high profile something for you to do, but meditate for a few minutes in a day. That takes the stress off. That the way we are composed in this life, they are just the left and right extremes of literally everything. Our races, you have the white, you have the black. You have colors, you have the white, you have the black. You have in your system, you have the nervous system that generates activity when you're nervous and excited. There's the one that gets you to relax and help you digest your food. There's always like a counterbalance to everything. So if you're doing a lot of stress activities, you got to find a way to relax during the day and during the run of the month or the year. You try and take some vacation time. Get a dog. Dogs have been shown, honestly, dogs have been shown to drop the blood pressure in a lot of people. But I recognize the dog may not be perfect for everybody. Not everybody likes a dog. Not everybody finds fun with it. Some people may even be allergic to dogs. But overall, the dog makes you happy. You gets you to walk the dog. I mean, you
So,
literally have a lot of benefit in owning one. You know,
okay, so let me ask you another question.
so I have
So
run through a bunch of things that you can do on
right,
your
right. So
own
let me
that
let
can
me ask
reduce
you
your blood
another
pressure.
question, Doc. Let me
Yeah.
ask you another question. So what
Yeah.
disparities in diagnosis, care, or outcomes do you see in Black men in your practice?
Okay, in my practice, I will actually take an example. A gentleman walked into my clinic. He's probably the first Black patient that walked in as an urgent care provider. He walked in the afternoon. In fact, my front desk had just gone out to get lunch when he walked in. And he had called the phone to tell me that he was coming. I actually answered the phone when I realized there was nobody to answer in the front desk. So I now went out to the and saw him there. He was struggling to breathe. So he told me he's an asthmatic and he needed some help. He's a Black gentleman. He said he lives in California and then was doing some work, mobile work over here, and had not been taking his asthma preventive medication. And then he also took some drinks, power inducing drinks to help him get on with the work because he's a contractor. But he now suddenly found himself breathless and he walked into the clinic. So right away, as I saw him struggling to breathe, I got some non-rebreather oxygen in him and he started feeling much better right away. His symptoms weren't particularly those of an asthma that was challenging, so I didn't go with the broncho. I just gave him some oxygen, good old oxygen, and he started feeling better. As we were talking, I tried to get him to an exam room. I got him there and sat him down. We took the blood pressure. It was about 180 over 120. Now, it's a good thing we're talking about blood pressure, and I will make more comments about that number. But shortly after taking that, I said, hey, why don't we get you to just relax a little bit? He said he didn't sleep at all the night before because of the breathing challenge he had with his asthma, that he needed some asthma treatment. So as we were talking, getting him to relax a bit so we can get a better assessment of his blood pressure, he slept off right in my exam room. He slept off and was snoring and he was deeply asleep. I was stunned at how quickly he just went into sleep.
This
And then
is
by
while
then,
you were talking to him in the office?
as we were just there trying to get him to relax in the exam room, we're not in the, we have moved from, the reception to the exam room. So I told the assistant who came in later to just leave him alone and let him sleep. He slept for somewhere about 35 minutes. Sound sleep. I was astonished at how well he slept. And then his phone rang and woke him up. And then by then, after his encounter with the phone, explaining to whoever hired him to do work why he was getting help in the clinic, we repeated the blood pressure. He had dropped his blood pressure. Both the systolic and the diastolic had dropped down by at least 10 to 15 millimeters of mercury. But that is still not the accurate blood pressure for him. That's kind of what my point is. If you are monitoring your blood pressure, assuming you have a device at home, it gives anybody looking at it an idea of where your actual blood pressure may be. Now, the recommendation is that 120 over 80 is kind of the recommended blood pressure you want to have in the United States. But the blood pressure is not just one figure, one number. Some people do better with lower, some people do better with higher. You just want to find out where you are. Now, if you already have a condition that is ongoing, assuming you have a heart condition that is related to diabetes, reducing the blood pressure actually gives you a better outcome, or you have a kidney problem, for instance. So there's just a lot about how you live your life to control the blood pressure scenario. how you organize things that helps the decision making for the physician who is going to see you, if he knows what he's doing. And before this, I'll try to give some tips about what you get in a doctor's office to actually help you to know if the blood pressure they are measuring is actually accurate or not. Those are little
So
tidbits.
you're actually educating me on something. What you're saying is different people have a different baseline,
Yes.
and
So
so
what happens?
everybody
What
needs to
happens?
be. Go
Yes.
ahead. Go ahead.
What happens in medical practice generally is we do a study of a population in an area and try to use it to get a sense of where the baseline should be, where what is the standard. Most physicians understand that, so they want to see if they can figure out where you're. Now, just imagine you went to work and you finished work. You had an appointment with a physician, just like most of us do, and you had lunch, you are running around, you finish work, and then you have to meet the physician's appointment. You run down to the clinic and they get your blood pressure. Do you think that blood pressure is accurate? Even if it was accurately obtained, do you think it was an accurate reflection of what your blood pressure should be? It's most
Right.
unlikely.
Absolutely not.
So
Right.
yeah, so if you had a system where you measure your blood pressure, you measure it at home and you have a chart for it, that way nobody will argue with it. And you show that to anybody, that's a more organized way of looking at you and getting a sense of where you belong in terms of this blood pressure thing. The other thing is you don't have any of that, and all of a sudden you are symptomatic. You're getting palpitations, you're freaking out, you're hearing your heart beating all the time, even when you're not agitated. That's palpitation. That's actually a symptom that something is going wrong with your heart. And
Mhm.
then, and then you go from there, you're having this headache that is uncontrollable, or you just pass out altogether. Those are situations where things are now no longer negotiable. You have to see somebody to take care of it. While on the other side of the illness, you may have met somebody who would have helped you go through some lifestyle changes. Just imagine having deep breathing exercises, for instance, at home. You wake up in the morning, or you before you go to bed, you take 10 to 15 minutes of in a quiet environment. Even you can feel the difference, how you feel doing that. You know, listen to some soft music, do some meditation, say a prayer. I mean, almost all of us are Christians or Muslims or whatever we choose to be. Say some prayers, spend some time, communicate with the superior power around you, who however you choose to define it. Those are quiet moments that influence that stress offloading aspect of the day that you have experienced. And
One of the
10
things.
minutes, 10, 15 minutes is not a whole lot. It's just, I just wanted this conversation to go in the direction I'm driving in, because I think that's what is important.
So let me
Look at
let me
your life.
ask you this. Let
Okay.
me ask you this, Doc. So how
Yeah.
do cultural norms, stigma, and mistrust of medical system impact early detection and
That's
treatment
it.
in our
That's
communities?
that's a beautiful. There is a history of blacks being used for experiments, but the truth really is, while it may be a punitive thing to look at, every medical every medical adventure, every medical discovery has been done with experiments. You start with animals and you move to humans. I mean, it's not the fact that somebody injected maybe some syphilis to black people at some time in the history of this country to figure out how the curse of the illness kind of presents. It's bad. It's not something I can, give credit to for however knowledge or whatever knowledge. But the Germans during the Second World War had Jews do play the same role. Yeah, it's not something that you want to give credit for, but it's kind of the history of the world. So the black community has found itself in this situation where they don't trust the medical outfit in the country, and most of them try to stay away from it. But like I said, we are the privileged generation. We live in 2025. There is so much available that you just need to step out and take advantage of it. Take
So
advantage of all the things that make you happy. Those things will help your blood pressure to be down. Just take list.
you know,
We are all different human beings. You need to list what it is that brings happiness. Is
you
it
know what
some
brings me happiness, Doc? I
what?
really enjoy I really enjoy a good massage. I
Okay.
like to go for a massage. Is that a healthy thing to do?
Oh,
Um,
honestly, honestly just it's almost similar to the yoga people talk about. Similar to meditation, a private time somebody gives you a massage. It's good if you can get it in more very qualified hands so that you
yeah,
they can
I
they,
go to a professional to get my massages done.
exactly. I'm specifying that because the ability to give you a quality treatment, if it's a massage treatment, you call it, it just kind of borders on the knowledge of the person who is providing it. So yes, a quality massage will give you. And I think that the Japanese or the Chinese have a culture where you go into the jungle and spend time. And people actually did studies and found out that you actually it reduces the blood pressure by engaging in that activity. And
I
if
think
you
it depends on who you encounter in that jungle, Doc. If they're
exactly exactly it seems on how you kind of put that that activity down. If you get in there and find something scary or whatever situation you run into, then that's a whole different thing. But the concept is similar to what we have available here. You stay in the jungle, the leaves generate oxygen out of picking up your carbon dioxide by their normal photosynthesis activity. So there is an enriched oxygen environment, and you sit there and there's silence. You spend a few
so,
minutes there. Those activities, those are the same deep breathing you're doing. Some people get in the oxygen chamber to get that amount of oxygen. And you'll be surprised how that improves your whole system and makes you more comfortable. That's we're looking at look at life and see those things that help you feel and be better and take advantage of them. Now, I will not run away from things like cigarette smoking. There's a data I'm looking at, and I'm stunned that almost 33% of high schoolers have indulged in that is not good data. In Canada, for instance, 17% of the population smoke. America doesn't seem to have such a beautiful direction in terms of how the people will smoke. Cigarette smoking. I tell my patients is one thing I've not been able to find any advantage. Like you may find advantage in drinking some alcohol, get some relaxation. Cigarette is just one thing that I just feel that should be banned or something. And people don't. I mean, it just brings problems all the way as far as health is concerned. And I recognize the battle against the tobacco industry and how they survived all that. But the reality, from what we know medically, is cigarette is just not good for you. But the smoking and the nicotine in it, the tobacco, all that there's just no place for that in any healthy seeking adult. It's
so
a habit that I would just say, look, once again, there's a revolution around how you can get rid of cigarette. you know. So
so
we
Doc,
talked about exercise. Okay, sorry. Mhm.
I want to ask you another question in particular, since we're talking about Black men. I really want to
Yeah,
ask a few questions about Black men in particular. For example,
particular. Yeah.
why is hypertension so prevalent in Black men, and why is it often undiagnosed or untreated?
That's one of the things I had pointed out. If you have this income this disparity, so the low income people tend to smoke more.
Mm.
One is, for a myriad of reasons. The more depressed people are, the more psychologically challenged they are with psychological illnesses, the more they tend to indulge in something like cigarette smoking or
So,
excessive drinking. Now, those are kind of fundamental confounders
well, I've
that
got so
tends
I
to tilt the statistics in the negative favor of the black population. That's kind of
so
what I'm
wait
trying to spend
so
all the
Doc,
time and talk about. How do you manage, your day to day? That's kind of where I want to stay for this conversation. How do you manage your day to day and
but
avoid?
is there something though that impacts Black men in particular, because not all Black men, of course, are poor. So not all Black men have a poor lifestyle, but many Black men, regardless of their income, tend to have to be diagnosed with hypertension. And I'm just curious about, is there something else that might be at play there besides maybe poverty?
No, so the stress load, for instance, the stress load that you have to deal with as a Black person is actually higher. There's the societal discrimination, there's the stigmata, and there's the income differential. There is just a truckload of problems that challenge this population. And what I'm saying is that, yes, the history is there to justify some of these things, but the time is here when these, okay, another thing that you want to look at, even from the genetic point of view, is that some of these things become genetically it kind of picked up. Your genes actually pick up some of the environmental challenges that you might have dealt with, and they manifest. You understand? So that even as you're moving away from poverty, some of the things you picked up growing up still play out. Like,
So
take
maybe
for
still
instance,
a poor diet or
yeah, poor diet, your desire to want to do something that is not in these things I'm pointing out. You have a circle of friends who indulge in the kind of activities that tend to drive this stress in the negative direction. So those are things that I'm trying to emphasize, that if you can find a way to have a much more healthy lifestyle, and the way you do it is to try to bring in good quality ideas into your existence without making it some project, like exercise, for instance. If you have to feel like you must go to a gym or go to some fancy place to do exercise so that you can do that, then it becomes a task that you have to now be looking for time when you're going to be able to do it. But if you make it a part of a routine where you do this as part of getting your shower or something, okay, just imagine you get in the shower and you have a bracket on the door there that you can do a full pull-ups. So
Whew,
your
I'll break my
routine is
shower door.
your routine is you brush your teeth, you do pull up or lift some quick weights, or even use the thumb press and that kind of stuff for a few minutes, and then you get a shower. Now, it's something you have introduced into your routine without it needing some kind of special allocation of time or budgeting it's just in the room there, you can do it. You understand?
Yes. So let me just stop you just for a
Or
second to let
sit up.
the audience know we are talking about black men black men's health matters today, preventing silent killers.
Yeah.
I am Dr. Vanessa Enoch, and I am here with Dr. Chike Obioha of St. Richard's Clinic. And St. Richard's Clinic is located in the greater Cincinnati area in Mason, Ohio. And the phone number at St. Richard's Clinic is scrolling across the bottom of your screen. It's 513-306-4910. Or you can learn more about St. Richard's Clinic at www.strichardsclinics with an S on the end.com. St. Richard's Clinics with an S on the end clinics.com. And Dr. Obioha, well, let me also say for the audience, if you have a question, feel free to put your questions in the chats on whatever platform you are watching in. We're live on Facebook, YouTube, and LinkedIn. And so if you have a question, please feel free to put your question in the chat. But Dr. Obioha, what are some symptoms, if any, that Black men should look out for? Or is it truly a silent condition? Are there symptoms, or is it always just a silent condition that they have and they have to go and get tested for?
Your high blood pressure is better picked up before it has symptoms. By the time it has symptoms, it has destroyed some other end organ. One of them is the heart. When the heart starts doing palpitations and start hurting with features that you're beginning to have some ischemic disease, it means that it it has gotten you. And then at that point, it becomes necessary for you to have somebody managing that as a physician or provider. What I'm trying to move this conversation is, what can you do? You're a 20-year-old graduate from, from high school, from college, or whatever. What can you do to live a much better life and stay away from this problem? Have a primary care provider. Once a year, get in there and even get the nurse to get your blood pressure measured. Have a blood pressure equipment at home. It's not going to break the bank to get. And use it, not just have it, try to actually use it. Now, how do you do a proper blood pressure measurement? Don't put the cuff over your dressing. Try to use the left hand. Try to use a cuff. Well, most retailers will give you a cuff that is within an appropriate size. But the size that is appropriate is 1/3 the distance from the elbow area to the top of that of that your upper arm. If the cuff covers about 1/3 that distance, it's probably a good cuff. The automated cuff systems work better because it gets to get multiple measurements and then try to give you multiple measurements are always better when it comes to blood pressure. Now, if you go to a physician's office, you get to look out for how they actually measure the blood pressure that they are measuring. Are they putting the cuff over your leg? Are they just doing it in any hand? Or the wrist ones people do, but the more better blood pressure measurement is the one you get from the arm. Now you want the measurement to be done as much as possible leveling with the heart. So if somebody is have your hand dangling down there and is measuring the blood pressure in a clinic, even in a physician's office, that person is probably not doing right. And the numbers vary. Those millimeters of mercury make a lot of difference in terms of making an assessment on what to do for you. Now, if somebody is trying to control your blood pressure, it's best you give him the best in terms of the number. Now, if somebody measures your blood pressure and you have your legs crossed, or you're pressed to go and pee, and you're still doing the blood pressure, those are things that radically change the number that you'll get, and that influences the decision that the physician makes. So you have a bunch of people who are on blood pressure medications, and they actually have symptoms that the blood pressure is over control. Now, that's not a good scenario, but actually, the lower the better, most people say. The chances that things are going to be worse when they're much higher is more likely. The much lower blood pressures are not likely to harm you most of the time as much as the much higher blood pressure. Most of the low blood pressures will get that can harm you. And once you get when you're in the hospital, maybe you're in the ICU and that. But there are people there monitoring your blood pressure to actually do something about it. So the
Dr.
emphasis is more
Obioha,
on controlling the high blood pressure than sorry.
Let me ask you another question.
Yeah.
Now, you said that they should have a primary care physician. Now, is that a
Yes.
service that you're able to provide primary care? I know
definitely.
you specialize. And can you tell us about your specialties and also if you provide primary care?
I do provide primary care, and the idea of primary care is to have a vigilant physician who knows your wherewithal in terms of your health, and who can actually give reference to another provider if you needed a specialty care. And then if you do get that specialty care, just imagine you've had a surgery, for instance. When you go in for surgery, medications are modified to make you appropriate to go ahead and get the surgery. And then after the surgery, there are some recommendations in terms of being able to get back to those medications. Primary care is able to look at those medications and know when to put you back on them. I'll give you an instance. If you're diabetic, for instance, and you're going to go have a surgery, most of the surgery will, if it's abdominal surgery, or even long surgery that lasts for a long period of time, you probably need to fast in order to do the surgery, the anesthesia complications and challenges. So those fastings may necessitate them taking away some diabetic medications you're taking and change them to something that can control your blood sugar, but is easier to manage in the hospital, like switching you from oral hypoglycemic medications into insulin, for instance, that you can short-acting insulin that you can easily monitor how the blood sugar is controlled. Now, when you're done with the surgery and you're discharged, you need somebody to look back and put you back on those medications. That's what the role of a primary care provider is. Now, if you had a surgery that affects your ability to eat, how do you titrate the eating so you can get from being able to get some nourishment to the point where you can fully recover to eating your normal diet based on the surgery you have had and the surgeon's recommendations, for instance. So those are little things that the primary care provider could do, and also make sure your pain control is actually is for the surgery you had. You had a wound, they can actually look at it. But in my clinic, in addition, we have wound care available that can take care of your surgical wound challenge. So, yeah, I do provide. I'm board certified in occupational preventive medicine, and also be able to provide primary care to patients that need that.
So
Now,
while we're on the subject of diabetes,
yeah.
how does it manifest differently or more aggressively in Black men?
So once again, the confounders coming. What diets they do, what activities they do. It seems like the whole cycle just seems to revolve around this population. And then what is their attitude to health? Do they seek help to try to determine those problems that are not easily diagnosed unless you're seeing a physician? Assuming you see a primary care provider, and that at least for annual physical once you're up to age. That annual physical is going to give out a few things about how your sugar A1C is behaving to know whether to be cautious about it. That annual physical will look at your weight and see if it's gaining or losing or steady. That annual physical will look at your blood pressure and also examine your kidneys and get information that could help create a baseline for you. And then as you keep doing that, the baseline is seen to either shift forward, stay the same, or go about better, depending on that interaction with your primary care provider. Now, if you take that seriously, then you're not likely to be caught with some silent killer at age 30 or age 40 because you're doing the right things to see if it's there, is picked up on time, and it's addressed without it being a complicated challenge. But if you're not, then you're just kind of wandering in the dark in terms of your health. And then something happens, and then that triggers this situation where you are diagnosed already with complications of illnesses that you may have been, like, let me take, for instance, weight gain. The world we live on today have medications. You actually listen to the news. You have a bunch of medications. They're actually competing with each other, the ones that can help you control your weight. You take the medication, control your weight. If you get the weight that you're comfortable with, you can stop. Now, do you need medication to control your weight? That's where I come in and say, no, you don't have to. You can actually modify your lifestyle and control your weight. Certain weight measures like BMI, which is not perfect, but at least it's something there available to you to help guide you to keep a moderate weight and enjoy your youth, get into your middle age and keep going, you know. But when the weight is too much, it pulls you down. It creates challenges like this blood pressure challenge that we talk about. It pushes you more to the diabetogenic situations that could drive such metabolic illnesses. And you need you to take the responsibility to go and be better. Nobody's going to come and grab you from your workplace or something or lock you up to try and make sure you're good. You, as an adult, has every right to make the decision and say, hey, starting from the month of September, which starts on Monday, I want to be better. I want to call a clinic and see somebody and talk about my health. Certain things about your health you will shock you. Like if you had a sibling who had a cardiac event, that means that you are potentially at risk of having that. If you have a parent that died from a heart problem, you should be looking at your heart to make sure that you don't have the same scenario happen to you. If you had a sibling who had a cancer, depending on what cancer it is, it may just have a family. So these are things that we send some kind of questionnaire for you to fill out if you come to my clinic, and almost every other clinic on the planet, honestly. And what that information, you'll be shocked how much it influences the encounter between you and somebody who knows what to do with those information. And that's just what we are feeling. And most times, if you have a health insurance, use it. They will pay for your annual physical and the tests that you may not have to do anything out of pocket. So these are just. I'm sorry.
Yep, let's I want to do because we only have a few more minutes here.
Oh, really?
I want to ask a couple of questions.
I'm sorry. I just feel like we should have this session again. I really need to be a little bit more organized in
Yeah.
rolling out some of the information. But
Yeah. We can.
it is just shocking to me how much is available and people are not taking advantage of it.
Right.
I mean, you know, if you had a motor accident and died from it, it sounds more reasonable. Or you went in a plane and the plane crashed. It sounds more reasonable to me than you having some illnesses that are just at the peak and the corner for you to deal with and live a much more fascinating, enjoyable life free of illnesses. So, like you had pointed out in one of our conversations, most illnesses that will start manifesting themselves at age 40 would have started at age 20 or would have been based on what you subjected yourself to or did not at the age of 20. So at age of 20, that's the time you start doing things right to push yourself to have a better age 40. And if you're already doing that at age 40, then at 60, you are much, much better off. At 60, if you're much better off, then you can get to 80 or 100. I mean, we just want to have a long life. And then if you get to 80 or 100, you see your kids, your grandchildren, and you get to play with them and enjoy the rest of life until your creator or whoever calls you out of this planet and you move on. And the more of us who can do that, the more you can teach that to a younger generation, and then you start changing the dynamics of the data that the Black people have been subjected to for most of the history of this country.
So, okay. So I want to do a quick round with you, Doc.
Okay.
First, I'm going to ask you first one question, and if you can answer that one briefly, then I'm going to do a quick myth busting round with you. So the question I want to ask you is: prostate cancer rates are disproportionately high among Black men. Why is that?
That is really so. I was listening to a documentary recently about some group out of Florida that went ahead to establish prostate care surgically in Angola in Africa. They were pointing out about the high incidence of prostate cancer in Angola in Africa. Now, is there, and most of Africa really, because I train as a surgeon there, it's unlikely you go to training and not have, have encounter with people who have it. So is there a reason why it's disproportionately more in the African compared to the Caucasian? Some people will look at diet and see hormone, because it's one of those hormonally influenced cancers, just like a breast cancer. That may be diet that drives a higher hormone, profile in blacks. That's just an assumption. It's not a fact that I'm stating. But those are things you look at and wonder: is that why that is? Blacks, whether they are in Africa or they're in Americas or any other part of the world, seem to have this challenge. Rearing his head. But the truth about it is, just like breast cancer, the success in cancer treatment has actually been in breast cancer and prostate cancer, those hormonally driven cancers that you can, use what is available to you to detect them early. And if you do, you get a treatment that gets you free of the cancer and keeps you in the eyes of the physician to be checking you and surveilling you to make sure that it doesn't rear its ugly head. But if it does, it's nipped early and it's taken care of. I have a lot of friends who have survived, who are survivors of prostate cancer, and I have lost a few friends, even a sibling, from prostate cancer. Now, the challenge is just about the attitude of the individual. Someone like me, I get annual physical, I get my PSA tested. And if the PSA is showing anything that's concerning, I will have my prostate evaluated. A physician will put his hand in the prostate area and try to feel and see if he can feel anything wrong, and then subject it to ultrasound or even biopsy to see if they can figure out why the PSA is abnormal. If it is, then we go after it. Look and see, has there been a spread? Is it contained within the prostate? Has it gone beyond the prostate? Do we need to do a surgery to take it out? Do we blast it with radiation and just kill everything around it? Those are decisions that will be made based on early detection and the radical treatment for it. Now, when you wait to the point where you don't do these things, nobody knows, and the time we figure it out is when the disease is gone past where you can manage it aggressively and get rid of it, then you run the risk of ultimately even dying from the disease, because it's caught early, it's more difficult to treat, and the treatment of late disease comes with a lot more challenges, including not being able to rescue yourself completely from the cancer, which ultimately can spread like any other cancer and give you an early demise from this planet.
So
That's the much I can say about it,
yeah,
But
let's do the myth busting round, Doc.
Okay.
We can ask. We've got several questions, and
I would actually expect more people to ask questions on these subjects, because those are things I have lived with, as being in the population of people who deal with this, have had family experiences that have actually improve my desire to see how I can make other people enjoy a free life of these conditions. And
so
honestly,
let's do the myth busting round.
okay.
So true or false? If
Mhm.
I don't have symptoms, I don't need to see a doctor.
That is so false.
All right.
Honestly,
The next
that is,
question.
so
The next question.
let me stay on that. Let me stay on that. So as a child, your parents take you to see a doctor called a pediatrician. Most pediatricians will see a child going back to school and make sure their vaccinations are up to date. They get an annual physical. Why would that change for you when you get older? I mean,
All right.
your
It
parents have
makes
given you the
sense.
benefit, so you
Makes
take that
sense.
on and keep moving. And we're talking about one in 300, and that's a few minutes in 366 days, the 365 days or whatever. I don't think it's too much, honestly.
All right. All right.
It's just about modifying your attitude to things and habits, and you'll be better off.
All right. Next question, Doc. In the myth
Yeah,
busting round.
yeah.
Natural supplements are safer than prescription drugs.
Natural supplements are better than. In fact, the reason I took on this subject was to emphasize on the natural things you do to avoid being on prescription. So, if you let me take for instance, if you're already on prescription for blood pressure and you modify your lifestyle, you can get to the point where the physician will take some of those medications out, because your lifestyle is now showing that you don't need that amount of medication to control the blood pressure. So you have now adopted a lifestyle to help you change your medical outcome. And that impacts on the medication. The medication comes in when you have tried some of these modifications in your lifestyle and you're still not able to beat the blood pressure that's creeping up. And that's why we try to have a standard, 120, 80, whatever it is, that seem to work within our population, that we try to kind of size up there. But it's not like a measuring gauge where we give you some medication and try to check the blood pressure to make sure it falls down to that. We just want to keep it in that range where it's something that is comfortable. And now other things I didn't mention is your sleep. I forgot the sleep. They recommended is 7 to 9 hours, somewhere in the 8 hour range. As you get older, you find out that that's not an easy bargain to get sleep. But there's the few things about sleep I just wanted to point out is some people. For my thesis for my master's program, I decided to do a study with questionnaire among truck drivers about how to use a questionnaire to isolate sleep challenges in our population. They tend to have a sleep apnea problem. Now, that's some questionnaire you can actually download online and do that for yourself and say, do I have a reason to be concerned about poor sleep? Is it due to sleep apnea? And then you get a sleep study if you go to see a doctor. And then if there's a problem, then there's a treatment for it. Because that poor sleep or sleep apnea is something that can drive your blood pressure and ultimately give you heart problems. So why not just take the initiative and just try and do something better that could help you? You'll be surprised when you do the first questionnaire that you can pick out online for sleep study, for sleep apnea evaluation. You'll be surprised so many things that you experience that you don't even think is a problem, but it's actually something that is pointing out that you have a poor sleep pattern that may be treatable. And I'm glad I had the opportunity to go into the sleep part. We've talked about so many other. Yeah, sorry about that.
So we have another myth buster question.
Okay, I'm waiting. I'm
Is
waiting for that.
So, true or false? It's too late to improve my health once I'm over 50.
It's never too late to improve your health. It's just never too late. Even if you're 90, it's not too late to improve your health. It's just a matter of recognizing that, hey, I want to be better. It's
All
almost like you have a burden on you and learning to make it less burdensome.
right.
Your
Okay,
health
Doc.
is a way of making your life better with less burden if you can stay ahead of your health problem. You know.
Okay, Doc. Last two
Mhm.
questions.
Okay.
The first and the last is how can faith communities, barbershops, and social clubs play a role in promoting Black men's health?
My goodness, that's a loaded question, and the answer is absolutely, absolutely. So the thing about life of community helps you deflate stress. Let's take stress as just an example, okay? If you're stressed and you have someone you can talk to about it, you'll be shocked how much that itself is a treatment. Just talking to somebody, not even that the person can give you a way out of that situation. Let's say you had a financial challenge and you can humble yourself enough to talk to somebody about it. Just talking to that person makes you feel better in the sense that the person may just say that, hey, this position you're in, you're not alone. I'm not far from it, or person make a joke, or maybe the person even offers to help you out. So either way, discussing with just somebody else, not even when you have like a real organized group that has activities that help each other out. Let me take another simple example. Back to school, the kids are going back to school. Most groups will organize a little back to school activity for the kids and one give them that encourage, hey, we're here for you. That you seeing that for your own kid is so refreshing. I'm not going into all that plays out in the group itself. I'm just taking some specific little examples to give you how life actually works in a community. You understand? Just back to school, they buy some backpacks. They don't even have to buy. They may just take from, donations from those who had used backpacks and not needed anymore, and share it among the kids. The kids are delighted to get anything, any gift at all that came to them for free. It's just almost like, hey, my luck is good today. So that happiness, it goes around. It goes around to the kids. If it infects the parents are happier. They don't have to worry about buying that particular whatever it is that they got out of that. And then some people may sit around and enjoy a little barbecue. Talk about the problems. You'll be amazed. The challenges you have are not limited to you. And it is unburdening for you to realize by talking to others that those experiences you had in your workplace, on the road when you're driving to work, or in the school when you dropped your kid off, and you're not alone in it. That knowledge alone is refreshing enough to make you a better, healthier person. So community life cannot be overemphasized. You just need to find some community around you, and they said, be a good neighbor.
Okay,
That's what
so
it is.
Doc, okay.
Mhm.
Last question.
Okay.
All right. What's
Yeah.
your advice to women who want to encourage the men in their lives to go to the doctor without nagging or shaming them?
So one thing I love about the existence of a man and woman is heavenly. It's actually heavenly. The woman has more influence on the man than she realizes. Some of them do realize that know how to play the card. Some don't quite haven't figured it out yet. But I'm telling you that a man. I'll give you an instance of my dad. My dad was a pipe smoker when he met my mom. Yeah. They're both late now, but my mom couldn't stand the smoke. This gentleman had to quit that smoking to get his love life going. That's the kind of influence a woman can actually boost a man's ability. The man who is addicted to cigarette smoking, and lady say, look, I can't stand this cigarette and the smell of it. You'll be surprised if the man needs to hang out with that lady. He's gonna get rid of it. So honestly, the women have more power than they realize in terms of how they influence a man to do what it is they want. And most times the women are known to pursue better health and healthy life strategies. They just need to kind of drag the men along with them. So yeah, you can find ways as a woman and
All right.
resources that you can exert on your man and make him do the right thing so
All
that you
right,
can enjoy a
ladies.
longer life together. All right?
Ladies, you heard that. We have more influence than we think we have. So let's
Honestly.
take that into consideration. So,
Right.
Dr. Obioha, I just want to say thank you so much for having this conversation today. And of course, we will be having more conversations. And so, with that, we're going to close tonight. But I want to play a commercial on our way out the door. So again, thank you so much. And for anyone who wants to get in contact with Dr. Obioha at St. Richard's Clinic, you can reach out to him at 513-306-4910. Or you can learn more about St. Richard's Clinics at strichardsclinics.com. And thank you again, Dr. Obioha. And let's
the pleasure is all mine. Thank you so much for the opportunity to share some of this knowledge and the experiences.
Wonderful. And we're going to go ahead and hear have the commercial, and we will talk to everyone again soon.
Okay. Thank you.
Do you have an open, non-healing wound from surgical treatment? Bed sore, diabetes, or poor circulation? And you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.